Hello, Willows Health team. Here we have Professor Rishabh Prasad, Chairman of Willows Health, and Julie Love from Willowbrook here, who's going to be talking about Willows Health's Primary Care Network Award nomination.
Thanks, Barry.
Morning,
Hi, Julie.
Rish. What is the meaning of PCN?
So, a PCN is a primary care network, and they've been running for about 3 or 4 years, where GP practices have been working together to deliver services together. In Leicestershire, Leicester and Rutland, there are about 25 primary care networks. Willows is part of Aegis PCN, and basically it's the Willows PCN. We look after all the practices in that primary care network. All of our practices are part of this PCN, with the exception of Dishley Grange, which is part of Beacon PCN. And the idea behind it is that your primary care network is meant to be roughly one area, that's the idea, and all of the services which could be delivered at scale are done by the primary care network. So, for example, you'll all know by now that we've got to do extended access. From October, we've got to do additional hours on a Saturday. That's all done on a primary care network basis. So that's 30 to 100,000 patients worth of practices working together to deliver a service. COVID vaccinations, they were done on a PCN basis. Now, it's a bit harder at Willows to make the distinction because we are the PCN as well. But essentially, as far as the government's concerned, we're a collection practice under one umbrella.
Okay, thank you. Next question is, what are the GP awards?
So, the GP Awards, they are awards organised by Pulse, which is the largest, longest running magazine in general practice. 1960, so what does that make? I was like 60.
Quite old.
Quite old. I was going to do the math when I was like 62 years. A long, been going for a long time.
Younger than me.
And every year there is a process of nomination, shortlisting, and awarding, and they go through a whole bunch of categories. It's the Oscars of GP land, which is slightly embarrassing to say, but it really is. And like in the Oscars, the big one's Movie of the Year.
Yeah.
The PCN of the Year is the big one. That's the big one to go for, and we've been shortlisted, which I'm hugely proud of the whole team for.
So am I as an employee. I think it's amazing. Why have you been nominated?
So, probably for the wrong reasons.
Oh, right.
Okay, so when you look at an award, a nomination, they pick out all of the highlights, and we've got like tons, right?
Mm-hmm.
We did a whole incredible piece of work with COVID vaccinations. Not only did we do our PCN, we did other PCNs.
That's right, yeah.
Staff at Willows and Dishley Grange particularly were on the complete front line when it came to COVID, because we hosted hot tub services.
Yeah.
2/3 of the county's potential COVID patients came through our doors, porta cabin doors, but they came. We saw them, and we took a risk in where other practices wouldn't. We stepped up.
Yeah.
That's been recognised. In COVID again, we ran a tackle antibody trial. So this is a trial for a new treatment of COVID. The very first person in the entire world for that trial was seen 20 metres that way.
Amazing.
And that information actually sped up the treatment by 6 months. And I don't know how many lives were saved in that 6 months, but a lot.
Mm-hmm.
The other thing is, it's a function of our population, which makes us really attractive for companies to give us research. I know there's all the stuff in the press about riots, and it's just so sad. But what it means is, because our population is so diverse, it's really representative of the world's population. So the information we produce for trials is like nothing that Oxford or Cambridge or Edinburgh could do.
No,
that's what makes it really exciting. What other stuff have we done? We, the IT team, incredible work with all of the work to do with Teams and Office and getting our governance right. But if I go back to the beginning, I think we've been probably nominated for the wrong reasons. Those are great reasons, but I always think that the teams who are doing these activities, it's like standing on the shoulders of giants. We're only able to do that because of the work, like say you do at receptionist, where you've got someone older and you're thinking, that person needs to be seen. Without if the board and the directors didn't have confidence in the core services we do, we couldn't do all these other things. So really, the nomination and the selection and the shortlisting is about the incredible effort every single member of the team puts in every day to enable us who are privileged with things like research to go and do the other things. But this is about the whole primary care network. This isn't about one person, it's not about one division. We've all pulled together as a team in the hardest days of the pandemic,
Definitely.
pulled it off some great outcomes to be selected.
What does the nomination mean to everyone at Willows Health?
I think we should be super proud, right?
Definitely. Well, I feel proud.
Well, you should do. I mean, you know, there's
something to be very
there's
proud
like
about.
1,250 PCNs in the country.
Yeah.
There's 25 in the city. Sorry, 25 in the county. We're the only one in the whole of the East Midlands that could get shortlisted. So, I don't know. Often, working at Willows or in the NHS general can feel like sodding hard work.
Yeah.
Let's not get away from that.
No.
It really can. It can feel like the appointments are gone at 9 on a good day. Patients are upset we haven't been able to get appointments. It feels like the latest minister we've got is clearly of the same calibre of our previous health ministers.
Yeah, definitely.
Yeah, there's
It's
you know.
come out now,
Yeah, you know, and you think, what are they on about?
No.
I mean, I say that that's how I feel at times, but given the incredible challenging circumstances we face, we're delivering great services.
Yeah.
And, you know, I mean, we have a strategy at Willows where we've done these other things to support the core work. For me, personally, it feels like validation of that strategy. But for everyone, I think we should all be proud. This is great. Whether we win or we don't, it doesn't matter. So getting this
Being
far
nominated is
and
absolutely
shortlisted.
amazing. Definitely.
Down to the final 8.
Shortlisted, definitely amazing. Yeah. What do you want to say to those that don't feel they have anything to do with this?
You're wrong. I'm sorry. You're completely wrong. The award is every much as bit about the most junior apprentice
Yeah.
down to the most senior manager, Steph, and all of us in between.
Yeah.
This award recognises everyone's efforts to get to here. We're a complete team.
Yeah.
You know, if Manchester United win the FA, it isn't the captain's award. It isn't
The team.
the midfield. It's the team award.
Playing, isn't it?
It's everyone, and that's what this is about.
Yeah. And likewise, just how big is this award? Then you just obviously answered that by saying it's
I like
the
I said,
Oscars.
it's like the Oscars for GPs. I mean, I know it sounds really cheesy, but it really is. There is no other award for us.
No,
So this is the biggest industry award in primary
highest thing
care.
you could get, which
Yeah.
is fantastic. Yeah. And what can we take from this nomination?
I think we're good.
Yeah.
And I think we should be proud of the services we do. It can feel hard at times, but we honestly, we as a team are top of our game.
Well, I think said everything about it.
Thanks very much, Lily.
Thank you.